I learned that laboratory tests can be misleading. One of the commonest tests for thyroid is the TSH. It can be dead wrong. I've had patients come in on Synthroid, normal TSH, normal free T4, and tired and cold, constipated, depressed. Check their free T3, real low, give them some Cytomel or Armour. All the symptoms clear, they feel fine. So that's one of the commonest ways. TSH is one of the commonest things we see off. Again, we talked about the fact that patients are more different than we realize. And just kind of going through some of these things I've hit already there, but the genetics, the code we have can be different, and the way it's expressed can be different. Two different things there. What we eat and what we ate impact who we are and how we react to the environment. Hormone adequacy and balance can be different from patient to patient. Sometimes we have enough hormone, but its sister hormone is out of whack, like estrogen, progesterone, for example. Those have to be balanced. There can be various detoxification capacities, how well they clear waste in the body, variations in toxic load, different allergies, different sensitivities. And again, let me just pause right there. There's different definitions to the word allergy, and most doctors these days are focused on the immediate allergy. It's mediated through the IgE mechanism primarily. It's the fast-reacting thing, seconds or minutes. You eat the peanut, you got anaphylaxis. You have a bite of shrimp, you break out in hives. Very fast, seconds or minutes. Many allergies are delayed, particularly if we get into the food department or into some of the molds and some of the chemicals there. So they don't respond that way. It's not so quickly. They may take a half hour before the reaction shows up, or 10 hours, or even the next day before the reaction shows up. We use the word sensitivities to refer to things like chemicals where a tiny bit sets off a big reaction. Okay? There can be variations in digestion and absorption and other ongoing illnesses. The second line there, gastrointestinal problems are often associated with undernutrition, food sensitivities, and infection. I'd had gastroenterology in medical school, but once you do that, you kind of forget what's inside here. But it's very interesting inside there. That long 15-foot tube is very fascinating. And it can be inflamed, it can be infected, so it's not functioning properly. It's supposed to absorb, but not absorb the wrong things. I learned that chronic low-level hidden infections are more often encountered in chronic illnesses like fibromyalgia. I learned that metal toxicities can impair nerve, immune, and enzyme function. Metals like lead, aluminum, mercury. I learned that the allopathic approach that I've been schooled in has its place, a very powerful tool. Beautiful hospital we're in here, very good for acute care particularly, but it tends not to focus on stimulating innate health within the individual. And that's one of its drawbacks. Excellent for acute care. Well, what's fibromyalgia? You've heard definitions up and down, and you have to use something to define the condition there. Basically, you're hurt all over. You know about the tender spots and so on like that. Just the only point I'd like to make here in passing is that you don't always have to fit a research definition to fit fibromyalgia as your condition. But we do have to have that because you want to separate out some conditions from others. And just a word about defining syndromes. Our mental habits can strangle our thinking. One of the dangers of labeling something is that we stop thinking about it. And we clinicians, and I'm referring primarily to physicians here now, like clear science, and I'm devoted to science. And without it, though, we say that something's idiopathic. And if it's idiopathic, then we ignore thinking about it very much. Another thing we do is that if we feel comfortable using medications, we have this conclusion: if the drug doesn't fix it, it does not exist. And of course, if it does not exist, then it must be something related to stress or imagination or malingering. Call the psychiatrist. However, if we adopt the newer paradigm, we may find that previously unknown ways exist to help our patients with conditions like fibro. So here's how I'd like to look at fibromyalgia. I'd like to be a lumper in this situation here and lump it with other chronic conditions which are multisystemic. And I do that partly because of my training and partly because of a theory developed by one of the researchers at the University of Washington. I'll introduce in just a minute here on the slide. In other words, I'll just move with it there. This model of that fits the environmental medicine paradigm is also the approach of Dr. Martin Pall. There we go. I got his name right there. researcher here at the University of Washington. He has written a book called Explaining Unexplained Illnesses. It's come out just recently, and he lumps together fibromyalgia, chronic fatigue syndrome, chemical sensitivity, post-traumatic stress disorder, Gulf War syndrome, and perhaps others. And he proposes a new disease paradigm. In a few minutes, I'll go through and list the 9 accepted disease paradigms and add his, which would be number 10. And in this paradigm, it's an effort to look at the root of illness, particularly the ones we're talking about here today. And there are parallels between these so-called unexplained illnesses that provide clues as to the mechanism of how they function. And mechanisms are nice to have. One of the problems with conditions like fibro and chronic fatigue, multiple chemical sensitivities, and so on, is that without a clear explanatory mechanism, you don't get a lot of support through the academic world, the professional organizations, insurance companies, disability boards. And a lot of inroads have been made, I should say, if you think over the past 30 years, but it's a challenge. We live on mechanisms because they help us get a sense of understanding. But one of the good things here is that when we see that the mechanism with these unexplained illnesses implicate environmental stressors, we start to expand our thinking again beyond pharmacology. Can we be sure that fibromyalgia fits with these other conditions? Well, first of all, there's multiple overlaps. You'll look at the symptoms and you'll find that fatigue, pain, heightened sensitivities, and sleep disorders run through each of these conditions with different emphases. And a patient with fibromyalgia may also clearly fit the definition of chronic fatigue or multiple chemical sensitivities. So perhaps these conditions are variations on the same underlying condition with just varied manifestations. I mean, it's conceivable at some point in time there'd be a new name, and these 5 or 6 conditions would be part of that, subsets of it there. So that's just a way to think about it theoretically. There's reasons, however, not to lump these together, to keep them separate. One is that excessive lumping can hide the environmental issues, which, from my perspective, are important much of the time there. Not always, but much of the time there. There are some in our world here who would be happy to see the syndromes lumped together, the ones that perceive disease as medication deficiency, which requires no attention to nutrition and environmental stressors. And so if you lump them, you tend to fall into that category. But we want to be careful to keep all of the facts on the table. I hope this is more clear later on. All right. Before I get into a little bit more discussion of Dr. Paul's book on unexplained illnesses, and then move into some practical aspects of the management of fibromyalgia, let me just look at what the management goals might be that are reasonable. I think it's always good to start with a basic diagnosis. And that's where those definitions of disease like fibromyalgia and the tender points help. We want to exclude other treatable conditions. And sometimes you've got 2 or 3 things going on at the same time, and other occasions we have a person who thinks they have fibro and they don't. We also have to accept, as we're setting our goals here, that the degree of improvement can vary widely. I find that everybody finds some help, and often there's much help. At times, patients find long-term relief of symptoms, and might even use the word cure in that situation there. But as we look at our goals, I think we need to think not just about symptom control. I have less pain, I have more energy, but also functional improvement. I can get up, I can do things around the house, I can go to work. But then beyond that even, we have to think about modifying the underlying processes, while at the same time avoiding undesirable side effects, particularly for medications. So a lot of what I'm saying here is trying to look at this modifying underlying processes. Not everybody can be helped as much as they desire. Some things take more time. I think it's true of any of us. If we have something wrong, we want to get well. We want to get well right now. And we want to get perfectly well. Medications can help partially and are best combined with other measures. One caution here, though, that in our management strategy here, some of the acute care treatments can worsen the condition. Many folks with fibro or chronic fatigue also get into things like chronic sinusitis. And I'll use that just as an example, because a common treatment for chronic sinusitis is antibiotics. And if those don't work after a few months, antibiotics plus prednisone. That's not a good way to go, because that actually digs a hole and makes sinusitis worse.